Hi, you guys. Dr. Melanie Carlone and Pico de Gallo wants to be in the video today. He's hilarious. I'm a physical therapist, a somatic healer, and a lifelong learner about all things that bring our body back into integrated wholeness. And today I want to talk to you a little more about the trauma reflex. That pattern of injury where you've injured one side of the body and it's affected your ability to rotate, because the protectors are holding you from going into a position that approximates how you got injured, or the fascia is just pulling and restricting that movement. And there's some amazing things that you can do to bring the protector into your awareness, thank it for all the hard work, and let it go. So if you've been with me for some time, you know that my approach is very gentle and very tuned in to how the body works. If you have been here before, do me a favor and hit subscribe if you haven't done that already. It's that allows me to keep putting this content up and keep growing the word that I want to get out. I've been doing this 40 years, and there's so much that we can do to help ourselves heal that often in today's medical world we just don't know about. So help out a sister and hit like, hit subscribe, and comment. I always respond. Let me know how you find this, okay? So, Pico, are you ready? Are you ready? Okay. Oh, sorry, buddy. So, find yourself in a seated or cross-legged position, and notice you'll always go into a pattern that's familiar. So me, my right leg's in front of my left. Switch it up. Go ahead and change the other way. If you're sitting in a chair, just let your feet be flat on the floor. And this time we're going to experiment with rotation. So with my sit bones engaged, I'm going to go ahead and rotate around to the right and feel where the beginning of the resistance is. So in my right rotation, right about here, I can feel it, especially on my right side. And then I'm going to come around to the left, and that's the one that's usually very sticky on me. And that's about as far as I go to the left, rotating. So now we're going to bring in somatic awareness by tensing the protector, by tightening the musculature that prevents your movement, and then consciously letting it go. You engage what's called the gamma loop reflex, which tells the primitive brain that's making those muscles tense too much, I got you. I'm here. I'm paying attention. And they're like, finally. And as you softly let go, the musculature releases. So that's what we're going to work with. So I'm going to go around to the right first, my left hand on my right knee, and I'm going to turn to the tension. And then I'm going to imagine that someone's trying to push me further and I'm resisting. So it's almost like I'm holding on and I'm not letting them push me to the right. So all the protectors that prevent me from turning right are engaging. And as I'm doing that, I'm not holding my breath. I'm breathing. I'm letting my eyes turn to the left as I hold the tension behind my left shoulder and in my left flank. Hold, breathe, hold, and then softly let it go. 5, 4, 3, 2, 1, and then notice. Look at that. Moving a little more to the right. So now in this new position, I'm going to hold. And as if someone was trying to push me to the right, I'm going to resist. Resisting a little more. About 50% of my effort, holding my eyes turned to the left, signaling quiet to the nervous system. Breathe. And release. 5, 4, 3, 2, and 1. And the body lets go a little bit more. One last time. Now I have my hand in front of my knee, petting a small chihuahua. And resisting, right? Someone pushing me to the right. I'm pushing left. My eyes left. Breathe. And soften. 5, 4, 3, 2, and 1. Wow. Letting my head, my shoulders, my chest, and my belly come back. And now letting the turn to the right occur. And there's no resistance until I get here. The protectors on the left side let go. So now let's do it over to rotating left. So I come to where the tension spot is, bring my hand on my knee, and as if a giant hand was trying to push me left, and I'm saying, no, my protectors, you got this. My eyes go right, and I hold. Can't push me. Hold, breathe. And soften. 5, 4, 3, 2, and 1. Doesn't require force, just requires gentleness. And look how much further I go in left rotation. And once again, you must be noticing this too. Eyes to the right, resisting the push. Hold, breathe. Feel about 50% of my effort and soften. 5, 4, 3, 2, and 1. And then one last time. You don't need to do a ton of these, about 3. Rewiring neural pathways, re-educating the body in motion, resisting the push to the right, holding, breathe, eyes to the right, and soften. 5, 4, 3, 2, and 1. Wow. Letting your head go, your shoulders, your belly come back to center and feel inside the body. And now with a gentle awareness coming around to the right. Wow, so much more ease of movement, and to the left. So that is a contract, relax approach, somatic approach to releasing the protective muscles that prevent rotation when you've had a trauma injury. Remember to never push into pain, always be compassionate, and notice your gains. Notice what's working more than what's not. It changes the physiology of the brain. It really works. So, just finishing up here, I want you to feel your sit bones and very gently let your belly come forward, to the side, and to the back, kind of stirring the ocean in the lower belly. Slowly being aware of the motion in the lumbar spine, the thoracic spine, the neck. Allowing myself to stir that pot, each segment of my spine participating, and then coming back and going the other way. Breathing in, breathing out, feeling the inward motion on the sit bones, the hips, the solar plexus, the chest, the neck. And then go ahead and switch your legs to the more familiar position, and again. And you'll probably notice you have more motion that way. Feel free to sit on a block. If you can't sit comfortably with your legs not hurting and a curve in your low back, sit up on something. Don't struggle. Let the body know that you're paying attention to it and are kind. It'll respond. I always say, take one step towards your body, it takes 1,000 steps back to you, and it's true. And then go the other direction, stirring the pot kindly, thanking every segment, not just of the vertebra, but the spine, the spinal canal, the spinal cord, your brain stem and your brain, all of this amazing circuitry working to heal. So coming back, Pico, what do you think? Was that pretty good? Huh? Yeah? Thank you all so much. If you haven't hit subscribe, please do. I'm Dr. Melanie Carlone, Why It Hurts and How to Heal. Stay tuned because I have a lot more to share and I love doing this. Goodbye, you guys.